Now, we'll welcome Dr. Stefani Connel of Novant Health Family and Internal Medicine, South Brunswick. Dr. Connel, welcome to the show today.
Thank you.
It's such a pleasure to have you here, and we just spoke with Dr. Bell and learned about him and what his background and what have you, and now I'm really interested in you. So tell me a little bit about your education. Where did you go to school?
So I was born and raised in Oklahoma. I attended the University of Oklahoma and achieved a bachelor's degree in zoology and biomedical sciences. I then completed my medical training at the University of Oklahoma College of Medicine, and I just completed residency in Greenwood, South Carolina through Self-Regional Healthcare Family Medicine Residency Program.
Wow, so you're in family medicine.
Yes, ma'am.
Unlike Dr. Bell, he's an internist. And he talked about seeing patients at the age of around 18. So tell me about your patients. What do you focus on?
So historically, our clinic has seen 15 and up, but we are working very hard with our clinic manager to make it more child-friendly, and I'll be seeing children and adults of all ages.
Good. And that's kind of unique about family medicine, that they see the whole family. Is that correct?
It's great because you can see mom and the daughter and the grandmother and everyone. It makes a really nice dynamic, and I really love it because it allows us to really hone in on those families that unfortunately do have genetic things that run the family and other diseases, so we can try and prevent their children from having to face the medical problems that they now see their parents going through. So I love that about family medicine.
And also, I think, well, it's my perception that you learn a lot of things about the family dynamics, maybe by talking to one of the others in the family that might be affecting the patient that you're seeing at that point.
It's great to be able to focus on the social dynamic also whenever you see family together. And health is a team effort. I mean, so making sure that everyone is on board in the household about eating healthy, exercising, not smoking really makes a big difference. And families tend to tattle on each other sometimes. So if they said they're only eating one cookie a day, sometimes you learn it's more like 2 or 3. So toddlers are usually the best about letting us know what's really going on.
They will tell you. So what led you to make the decision to move to our area? I mean, I know it's beautiful here, and we have the beach and everything, but what was your personal story about moving here?
It was the beach. I have always loved the water since growing up, and when I was younger, I wanted to be a marine veterinarian, and none of that has dwindled as I've gotten older. I love the water, and so during residency, I tried to focus on being able to move somewhere near a beach and have those outdoor activities, and I just fell in love with the area. So I was really lucky to be able to have a position here at Novant to be so close to the ocean.
I think we're probably the lucky ones to get you.
Well, thank you.
That's awesome. When I reviewed your background, I noticed that you did a great deal of volunteer. You have a great deal of volunteer experience. So tell me about some of that.
I've been really fortunate to work with a lot of wonderful organizations. During undergrad, my focus was on Relay for Life and trying to work with their organization to not only raise money for cancer research, but also just awareness for the need for that. Most recently, our residency program actually teamed up with the local free clinic in our community, Greenwood United Ministries, that offered patients without insurance not only access to physicians and medical care, but also the medical supplies and prescriptions they needed. So that was a wonderful thing that the community provided, and I'm really glad our residency program was able to participate in that.
Yeah, that is awesome. While you're here within your practice, is there an area, a specific area that you'd like to focus on?
Preventative care, that's what originally drew me to family medicine, is being able to not only focus on the problems that the patient has today, but trying to plan for a better tomorrow. And again, that goes with the family dynamic and being able to really try and look through the family history and things that have really plagued the family in terms of medical diseases, and trying to make a healthy today and a better tomorrow for all my patients.
You sound like you have a speechwriter. You're so good. You're so eloquent, and you say it so nicely. And I love the message.
Well, thank you.
Before we wrap up, is there anything else that you would like to share with our viewers out there?
I've loved the community. I'm really excited to start seeing them in the clinic and to be a permanent member of the community. So, thank you so much for having me here today.
Well, it's been my pleasure, and I hope we'll see you again after you've been here a while and see how it's going.
Thank you.
Thank you.